Welcome to the Counselor Soapbox video channel. This is Learning About Alcohol, Part 18. In this video, we will be talking about treating alcoholism and addiction. This is a very brief introduction to the field, and drug and alcohol counselors frequently spend entire trainings on each of the items that I will mention in this video. Alcoholism treatment begins with evaluation and planning for treatment. Some of the things that a counselor will need to know how to do are evaluation, assessment, treatment planning, and screening. One particular tool for screening is the cage. We also need to understand how clients' medical issues may interact with their alcoholism, when to make referrals, and about things such as motivational interviewing, stages of change, and taking a substance use history. In designing treatment for alcoholism and addiction, we have to ask how it is that people recover. What does treatment need to do to help people change? And one of the first things that we need to do is assess. Assessment defines the problem with drugs or alcohol and how that problem, that issue, has interacted with the rest of that person's lives. Treatment should be linked to the assessment and the definition of the problem. There's no point in treating people for something that they don't have. One of the ways that we can begin to do treatment is to look at the stages of change model and see where the client is in their process of change. One way of understanding the process of moving from alcoholism or addiction to recovery is the stages of change model. In this, many people come to treatment pre-contemplative. They don't realize they have a problem, and they may not be ready to make any changes. As they move through the stages, they may begin to be thinking about the problem. We call this contemplative. They may begin to make preparation to make changes or become determined to make changes. Subsequently, they may begin to take action. In the early stages of action, they may be making small changes. Later in action, the changes become more dramatic. In the stages of change model, we have to think about what causes people to relapse. Relapse prevention is a major part of drug and alcohol counseling programs, and we need to emphasize the necessity, as with any other chronic illness, of doing maintenance to maintain any recovery that the client achieves. Someone coming into treatment for drugs and alcohol is never an accident. People don't show up at the Cancer Institute saying, I don't have cancer, but I'd like to try some chemotherapy. The reason people enter treatment, however, is often because someone other than the client thinks that this person needs help. That could easily be the police, could be a judge who has referred them to treatment, could be parole, probation, CPS. Often it's the client's spouse or family who wants them to get treatment. Increasingly, we see employers, employee assistance plans referring people to treatment because their substance use has interfered with their work. Some people reach the point where they realize I have a problem and want to change. While this series is focused on alcohol, it's important to note that alcohol problems are not limited to alcoholics. Many teens get themselves into trouble by experimenting with alcohol. Use of alcohol increases the risk of death by accident, suicide, or homicide. It also is connected to poor school performance, unplanned pregnancies, legal problems. A single drinking occasion can change someone's life forever. If the first time they drink, they get drunk and drive that way and kill someone, this could result in spending time in prison because of one drinking occasion. The best way to understand treatment from alcoholism is to look at it through the chronic disease framework. There was a time when medical doctors treated primarily acute injuries. You broke your arm, you went to the hospital, and it was put in a cast, or you had a heart attack and you were treated. Today, probably 3/4 of the things medical doctors treat are chronic, long-term conditions, diabetes, high blood pressure, and so on. And so in this framework, the way we understand it is once a chronic disease develops, it's going to require long-term treatment. Some changes in the body and the brain are irreversible. Recent brain science has shown us that the thing called epigenetics or gene expression, after a certain period of time, the switch flips and the same gene produces different results. Early detection and intervention can be important in treating and managing a chronic condition, and alcoholism and drug addiction easily fit into this chronic disease framework. The first thing that a counselor or intake person in a drug and alcohol treatment program needs to do is screen the client. And the way you do this is say, does this person really have a substance use disorder? Sometimes people are referred to a treatment program because they are homeless or have recently left jail or prison and have nowhere else to stay. It's important not to mix people who have housing needs with people who have drug and alcohol treatment issues. There are a number of screening instruments that can be used: audit, alcohol use disorder test, CAGE. I'll talk more about this in an upcoming slide. And screening is also considered a core counseling function. In one of the classes I teach, HS 43, we cover all of the 12 global core functions of a counselor, the things that a drug and alcohol counselor has to actually do on the job. This begins with the function of screening to determine if someone really needs the type of treatment that the program offers. There are a number of ways that someone could be screened for drug and alcohol use issues. In a hospital or medical situation, they might be screened using lab tests. There are web-based or self-assessment tools that can be used. People can look at the answers and see if they fit into a category. There are oral interviews, and I've listed a number below. Probably the simplest and most commonly used of those oral interviews is the 4-question CAGE test. The CAGE assessment for alcohol and or drug use issues has been repeated from person to person so long that I've seen variations from the original version. But the basic 4 questions are: C, have you ever tried to control or cut down on your alcohol use? Someone does not try to cut down or control use if they don't have a problem. A, are you ever annoyed or do you ever get angry when people ask about your drinking? Only people with a problem are likely to get annoyed and angry when they are questioned. G, do you ever feel guilty about things you did while drinking? Guilt about things you did while drinking indicates that when you drink, you may do it excessively. That doesn't necessarily mean that the client is an alcoholic, but it does mean that there is concern about what they're doing. Lastly, and the biggest one, is E, eye-opener. Anyone who needs a drink or a touch of their drug of choice first thing in the morning is well along in their way towards an addiction. A yes to one of these indicates a potential problem. Saying yes to more than one suggests that this person needs to look into professional assistance or a self-help program. In the past, most interventions for drugs and alcoholism were very long-term. Increasingly, we're seeing the benefit of brief interventions. Physicians who talk to their patients about their use of drugs or alcohol and how that is aggravating their medical issues, as little as 15 to 20 minutes of the physician's time has been shown to reduce that person's consumption. There's a thing called single session therapy. It's not unusual for people to go and talk to a counselor, discuss their problem, develop a plan of what they want to change in their life, and then go about changing it without the need for long-term counseling or therapy. William Miller created a system of designing interventions, which he calls frames. This begins with feedback. It's similar to a thing called assessment therapy. It doesn't do the client much good if the counselor makes an assessment but doesn't share the results with the client. If you tell the client what you see in the assessment, this helps them to decide what they want to do. The second part of the frames program is responsibility. Change is something that the professional helps the client do, not something they do to the client. It's necessary to give some advice, though not to tell the client what they should or shouldn't do. Often, the best treatment comes as a result of offering the client a menu of options or choices. Which would be better for you, this type of treatment or that? It's also important that the counselor express empathy. That's not feeling sorry for the client, but understanding what they must be going through. Everything that is done by a professional needs to support the client's self-efficacy, their belief that they are capable of doing things, rather than making them dependent on the counselor or professional to do things for them. When someone first enters treatment for drug or alcohol use disorders, it's important to determine whether they need medical attention. The use of alcohol and drugs can cause a lot of health damage, so it's important initially to take a look at their general health status. Do they have a doctor? How long has it been since they have seen the doctor? Do they think they need to be seen for some problem right now? Hospitalizations are also important. Not so much pregnancy or those sorts of normal hospitalizations, but have they had any history of medical issues which may have been affected by their use of drugs or alcohol? And has there been a history of accidents or fights while they were drinking? Also, it is possible for people to die during withdrawal from alcohol or to have significant health issues when withdrawing from other drugs. So the counselor needs to look at, will there be any problems if this person withdraws from their drug of choice? It comes as a surprise to many people that withdrawal from alcohol can kill. For most drugs, the risk of overdose deaths are greatest as the level of the drug in the bloodstream is rising. Alcohol is an exception to this. The person is likely to die while the level in their bloodstream is dropping. Some of the risk factors for possible medical complications while withdrawing from alcohol include past week drinking. Are they using prescription drugs, and are they abusing those drugs? Are they using street drugs? How much tolerance has this person developed? Tolerance defined as needing more and more of drugs or alcohol to get the same effect. How long has it been since their last drink? Have they ever had problems when they detoxed in the past? And are there any current or past medical problems or allergies which may become a problem when they detox from the drugs or alcohol? It's very important to note that counseling has a very high level of confidentiality. Very few things are considered exceptions. And substance abuse counseling has one of the highest standards of confidentiality of anything in a person's life. But emergencies are an exception to both HIPAA and the 42 CFR Part B restrictions on disclosing information about someone in drug and alcohol treatment. If someone's life is in danger, the counselor can provide information to a doctor or medical personnel about the person's conditions. Psychiatric issues may also arise when someone enters drug and alcohol treatment. One is the danger to self. Alcoholics, binge drinkers, are 55 times more likely to attempt suicide. IV drug users are 14 times more likely to attempt suicide. Also, people who are under the influence of drugs may lose the ability to inhibit their behavior and may be a danger to others. Some people, as a result of their drug intoxication, may be gravely disabled, unable to provide for their own care and housing. There can also be a great many physical issues which are the result of drug use, intoxication, or withdrawal. When someone comes for counseling, there's no point in keeping them in the counseling room or the facility if they're going to have a medical emergency. And there are some good reasons to make sure that that person goes to a hospital or medical doctor for clearance before you begin to do drug or alcohol treatment. If they have been drinking over 12 standard drinks a day and for 2 or more weeks, there's a high risk that they will have medical issues during withdrawal. If they've ever had a history of difficult withdrawals, especially DTs, that should require a medical clearance before they're put into a drug treatment or alcohol treatment program. Anyone with seizures or a history of seizures also should be medically cleared. Alcohol can reduce the seizure threshold and make it more likely that that person will have seizures while withdrawing. And people who are dependent on multiple substances at the same time are more likely to experience medical issues during detoxification or withdrawal. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the CounselorSoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.